Hello, my dear students. I hope you are doing fine. I am Dr. Anshul Diwakar, and I am a faculty of anesthesia, and I'm a faculty for an institute that is Delhi Academy of Medical Sciences, and I have been in touch with a lot of you, and there was always this question, ki sir, how to prepare for your final exams. We have already discussed the part of how to prepare for practicals. This is my approach that I want to give to all of you regarding how to approach your DNB or MD final theory exam preparation. And when I say DNB, then I mean both diploma as well as the DNB, that is a 3-year course. All right. So this is just a basic set of guidelines. I know when you begin, when then you look at the question paper and then you realize you hardly know anything, and so you feel somewhere ki, oh my god, this is too much, I have too less time, how I'm going to prepare. And this thought generally comes in the year when you have the exam. So if you are a diploma candidate, it will immediately come when your juniors come, that is when you reach the second year. But the moment you are a third year and you reach the third year, then this question starts looming around you, that this is what is going to be a big issue, how to start preparing, right? So I am here to just help you guide through this initial phase of doubts. And of course, I am somebody who is a diploma DNB. So I've given this exam twice. So I've given theory twice, I've given practical twice. And so what I did was, I never formally started preparing for my exam. But what I did was I made sure that whichever case I am standing in right from my first year, whichever case I am doing, I will do something about it. I will read something about it. Because I know as a diploma candidate, it would become very difficult because nobody was ever going to relieve us. We are still the juniors, right? There is a third year which is exam going along with us. So obviously the third years used to get relieved. They used to study, they used to do thesis. Everybody used to help them only. And the first years are still too young. And half of my batch is MD, so they don't have an exam, so they don't have any pressure, and half of the batch is diploma. So it's only the 6 of us who had this thing in our mind that we have to study. Rest, everybody around us got the privilege. So I knew from very beginning that a diploma candidate would not get too much of time to study, formally study. Also in residency, formal studying is something which is little problematic because frankly you are too tired to do anything when your postings are going on. And this is something that troubles most of you as well, because you feel so tired at the end of the day that you always tend to overlook the study part and like, हाँ कल करेंगे कल करेंगे कल करेंगे. So the best way of learning is in the theater when you have a patient. So one thing you can always do is you can start today. You don't have to wait for one fine day to start your preparation. The preparation starts every single day. Every single day you decide that you have to do one thing. And if you have got say 300 days of OT time that you have in a year, let's suppose 300 days out of 365 days you are in a OT, and if you decide to do one thing a day, then in 300 days you have done 300 things without really making any effort. And we have about 200 250 topics that we want to discuss in anesthesia to pass the exam. Of course there are over 400 things that you have to read, but to pass the exam 250 is enough. So imagine, even if you don't make any effort, then in 1 year time you will become very very good in anesthesia. So that is my idea. Always start today and start small. Don't think one day will come when you will sit and you will be able to do everything, and you will get time and you will read over Sunday and stuff like that. So let's begin with a comprehensive schedule for 3 to 4 months. For 3 to 4 months. Now, why do I say 3 to 4 months is because you will start thinking about exam 6 months before the exam, but you will practically study for 3 to 4 months. So even if you start 6 months before your exam, ultimately you are going to end up reading only 3 to 4 months. Rest of the things, either duty, post call off, or going home, or going out, or making some plans, or going. So ultimately this is what you need. 3 to 4 months of comprehensive, intensive, exam oriented study is what is needed to pass this exam. So duration of preparation is 3 to 4 months, which can vary for 3 to 4 months before the exam for you, or if you have started 6 months before the exam, then you end up wasting 2.5 months. The phases are: first read is always about 10 weeks. 10 weeks is about 2.5 months, and then revision for about 6 weeks, that is 1.5 months. So 2.5, 1.5 is 3 to 4. 10 weeks. So always divide your weeks and do it week wise. Goal is comprehensive understanding and exam readiness. Don't forget this point. The moment you start studying, the first thing comes to your mind is, sir, I have just bought one Miller's textbook of anesthesia and it is 4,000 pages. How to start? Sir, I want to be conceptually very strong. I want to read Miller. Sir, everybody says, all my professor says, if you haven't read Miller's, you can't be a good anesthetist. You have to read Miller's, but I don't find time in reading Miller's. Sir, Phil, will I be a bad anesthetist? Will I never be able to read Miller's? I know these thoughts are going to come because people who tell you these things in their residency also, they have never read Miller's. Miller's is a standard textbook of anesthesia. It is a guidebook of anesthesia. Everything that is scientifically done in anesthesia has been written in Miller's. There are two things that you need to remember about Miller's. One, Miller is not the ultimate book. For most of the subspecialties, Miller is not even a good book. Yes, for core concepts, pharmacology, I will say Miller hands down is one of the best. For positioning, Miller's is the best. But for rest of the subspecialties like pediatric anesthesia, cardiac anesthesia, neuro anesthesia, obstetric anesthesia, Miller is not even a good book. Two, it is not like if you haven't read Miller's, then you will not be a good anesthetist, because Miller's is like Harrison. It gives you everything that is available on that subject. Now, if there is everything, of course, if you read everything, then you will know everything about it, but you will hardly remember anything because you read it once. Your idea is to get the extracts of Miller. So if you go to any article, say you download a IJ article or a BJ article or a ATO TW article, then you always go to the reference section of that particular article and you see one of the references would be 8th or 9th or 10th edition of Miller. So the people who are writing the article have actually referred to the textbook. You are getting an extract of it. And remember, knowledge is everywhere the same. Knowledge doesn't change. Your choice of book doesn't define you as an anesthetist. How you perceive the physiology and how you perceive the changes under anesthesia and you know the anesthetic concerns, those are the things that ultimately help you remember stuff, do stuff properly and be confident about it. So never be in this dogma in your mind कि नहीं नहीं मिलर्स नहीं पढ़ा मतलब अच्छे एनेस्थेटिस्ट नहीं बन सकते. ठीक? Let's break down your preparation. The first read is about 10 weeks. You give yourself weekly assignments of key topics. So what my understanding is, you first start with concept building and what are the questions that are asked. So always refer to last 3 to 5 years of question. Again, when you will start, you will think I will do 10 years of paper. Now remember, if you are somebody who is a DNB, then DNB conducts 2 exams in a year. And each exam has 4 papers and each paper has 10 questions. So that means in one exam of DNB, you have about 40 questions. So in 1 year, you have about 80 questions. And in 10 years, you will have 800 questions. Even if you start reading 1 year before the exam and you manage to do 3 topics a day, still you would be not in a state to cover everything that has been asked in 10 years. Possible hai kya? We are talking about reading for 3 to 4 months. So is 800 possible? No. You go for most recent 3 years. My idea is first do 3 years. So 3 years is 240 questions. And then there is an overlap for about say 40 questions. So it's about 200 topics that you have to read. And that is what our target is. You start by 200 topics in 10 weeks. This is your first read, right? So that means 1 week is 20 topics. That is 7 days. So that is 2 to 3 topics per day. That is how I have always planned my study. It has to come down to the micro planning, what needs to be done. 2 to 3 topics per day. Topics. That means questions. So you start don't start prospectively. Don't open Miller's textbook of anesthesia and start reading CVS, physiology, then cardiac drugs, then anesthetic management of a patient with ischemic heart disease, cardiac patient. Don't do that. Why? When you are preparing for exam, if you directly open the book, see, if you are in first year and you are reading leisure reading, you are not reading for an agenda, then you can do this thing. But when you are preparing for an exam, you should know the format of the exam first. So if the exam is asking you anesthetic management of a patient posted for non-cardiac surgery who is an ischemic heart disease, you need to know that this is the most important part in the entire chapter of cardiac anesthesia. Non-cardiac surgery in a cardiac patient. What are your concerns? And look at the type of questions: pre-operative assessment, risk stratification, and methods to prevent intraoperative myocardial infarction. This is the most common question. What we end up doing is how to anesthetize somebody for a non-cardiac surgery for a cardiac patient. But what is asked is preventive strategies for MI. तो बीटा ब्लॉकर पूछा जाएगा, कार्डियोपल्मोनरी एक्सरसाइज टेस्टिंग पूछी जाएगी, मेंटेनिंग हार्ट रेट पूछा जाएगा, प्री ऑपरेटिव ऑप्टिमाइजेशन पूछा जाएगा, क्राइटेरिया रहेगा कि विच पेशेंट यू वांट टू गो फॉर इन्वेजिव टेस्टिंग, नॉन इन्वेजिव टेस्टिंग, योर गोल्डमैन कार्डियक इंडेक्स हो जाएगा, RCRI हो जाएगा. तो ये चीजें जो ज्यादा पूछी जाती हैं. बट जब आप पढ़ना चालू करोगे कोई स्टैंडर्ड टेक्स्ट बुक एंड यू स्टार्ट फ्रॉम पेज 1 टू पेज लास्ट, then you would often miss. So idea is that you cover first what is asked in the exam. Now if you have time you can start reading other things, but we are talking about exam preparation. This is the breakup that you have to remember. The moment you start preparing for your exam, 2 to 3 topics per day or questions per day. So you will have to spend 2 to 3 days of your time looking at past 3 years of paper. And a lot of people have done the hard work of compiling. Even I have given it to you in our WhatsApp group. So we have done a lot of hard work for you. But still I feel that you need to go and look at the questions from the question paper perspective, because that is when you understand whole format of the exam, that okay, there is paper 1, then 2, then 3 and 4. And now you are lucky that you have 4 days of exam on 4 days. So you don't have to really write. In my time, it was 2 days of exam, morning, evening, morning, evening. So it's like writing for 6 hours every day for 2 days. And it was extremely tiring because you just go, in the morning session is 9 to 12, then there is a 2-hour break, then 2 to 5. So then in that 2-hour break, you come out, you try to find a food joint, and there are hundreds of students. So you know, in that heat, then I gave the exam in June. So in June theory, that was very hot in Mumbai. So it was like, you know, you have to find your place, and then you have to eat, then you have to have a cup of tea, go back again, sit outside the center, and then again, you know, sit. So things are going to be difficult. So you have to approach the things in an exam perspective first. First, try to pass the exam, then try to become a PhD in anesthesia. All right. Then what you do is, of course, you are going to miss this target of 2 to 3 topics per day for 10 weeks by about at least 2 weeks. So you might take at least 12 weeks. So now you have revision for about 4 to 6 weeks, depending on when you started. But usually I feel for revision, you get about 1 month. This is practical. Ideal is 6 weeks. So then you consolidate and then you start writing. This is the most important part, writing. Then the last 1 month you have to write because you are relieved from your posting. So you're not writing anymore. Now you have to write for 12 hours, 4 3s are 12, 12 hours over a span of 4 days. In the last paper, even if your mind is working fine, your hands won't be working fine. You will get a lot of pain. In the first paper, your handwriting would be that you would only not recognize what you have written because you have not written from 1 month. So your mind, your mouth and your hand should keep moving like this. So whenever you sit in the revision phase, in the initial phase for 6 weeks, 10 weeks, even if you don't write, that is fine. Although I would want you to sit with me, watch my sessions and complete the entire anesthesia by writing it, because your exam wants you to write. So you have to practice writing. But even if you don't do that, in the last 1 month, every day for 3 hours, you have to write. So rough planning, week 1 to 2, you will cover things about general anesthesia, about monitoring, 3 to 4 regional and obstetric, then cardiac, neuro, pediatrics. So you take subspecialties, then pain, trauma, ICU, which are the difficult portions. So by this time, you have already gained a lot of traction. You have done substantial things. So you will feel interest in doing these things. And then miscellaneous topics and mock test in the last 2 weeks, right? So this is just a rough understanding of how you're going to approach your preparation. Now, while you are working, how do you prepare? The fact that I told you in the beginning, I'm just going to quickly go through this. I don't want to make this video too long. Do the topics what you are doing on the day of the OT. Suppose you have a long list today and you are doing a Whipples. So make sure in the 7-8 hours of Whipples, you finish Whipples: pre-operative assessment, intraoperative management, post-operative concerns and management of a CA head of pancreas patient posted for a Whipple surgery. Suppose someday you're doing a pheochromocytoma, so finish that. Laparoscopic surgery is very common. Laparoscopy exam ke liye very common question. So whenever you are in a lab case, anesthetic concerns in a laparoscopic patient, what are the effects of pneumoperitoneum on the patient, what are the positioning. So every single day you are sitting in an OT and doing a case, you finish that particular part. Start by easiest and shortest available resource. That is the question that they ask us the most. Sir, laparoscopy मैंने खोला मिलर्स में, बहुत बड़ा दिया है, मैं बोर हो गया, मैं नींद आ गई, छोड़ दिया. क्यों कर रहे हो? The people who write the articles are your professors only. You will find them around you. Even if you are in a DNB institute, if you ask the name of your teacher and you Google it up, they must have at least written one review article. I'm telling you, all these are great teachers and they have written great articles. And why have they written articles? Things are there in textbook, but they have written articles because they want a comprehensive yet a precise understanding of a topic and they want it to give it to others. So always start with the easiest and the shortest resource. The first is Google. And now you have, whenever you write something on Google, the first is the AI gives you some information. So that is the shortest possible information. And I heavily rely on IJA and ATO TW articles because they are very precise, very standard, and they are amazing to remember and keep on your phone. The best way to learn is to teach, and that is what I have been doing since so many years. So if you want to remember a topic, you read a topic and then you teach it to the junior. So first ask your junior some questions. Of course the junior won't be able to answer it. Don't tell them read tomorrow and come, because tomorrow na to wo पढ़ के आएगा ना आप उससे पूछोगे. But instead what you do is you make him stand there and you start taking a pen and a paper and you start explaining them that topic. When you start teaching them that topic, then you will realize that there are a lot of information that you are missing. Those are the things that you normally forget. So if you teach, you know that this is what you are not remembered. You go back and consolidate those parts. Rest you will become better and better and better if you teach your juniors every day. Finish all drugs while you are doing it. So what I used to do in OT was, whenever I touch a drug, I read a drug. The best way is when you open the pamphlet, open the pack, there is usually a pamphlet giving the description of the drug. Go and open that description. That description is almost similar to what is written in Miller's textbook of anesthesia. It has everything that you need to know very specific about that drug, because that is drug information sheet given by the pharmacologist. तो उसमें तो सब चीज सही लिखी होगी ना. They can't print something and give it to you and give a wrong information. So the moment you touch a drug, you read a drug, and the same thing happens to your junior. Now, how to prepare when you are on leave? The leave is usually between 30 to 40 days. Some people will get less, some people will get more, but you divide it into two parts. First 20 to 30 days and the last 10 days for revision. For first 10 to 20 to 30 days, you divide the day into three parts because you don't want to keep on sleeping and watching Insta. So you have a pre-lunch, then post-lunch, and then pre-dinner. Pre-lunch, you always start with the easiest topic, what you already know, so that you have an interest in reading. And post-lunch, always group discussion with friends. I prepared with the same individual for my diploma final exam and the same friend of mine for DNB final exam. We were lucky enough to be close by, and we did marvelously well in both the exams for the same reason, because when we went for the exam, we had this entire discussion of 15 days that we did together, where we curtailed every topic. Although I'm going to do that same thing, I'm going to reproduce that same thing in the RRR series, where I'm going to do a question answer type of thing on the topics that are asked in the exam. That is exactly what we used to do when we were preparing for DNB, and I'm going to recreate that for you. And then always pre-dinner go for heavy topics like super specialities, because that is when you are at your best. That is pre-dinner, in the last evening phase where you are between 5 to 8, and post-dinner just do some time pass. You don't really have to read the entire day and the entire night. In the last 10 days, start writing everything. So you should be able to write 3 hours per day in the last. This is mandatory. 3 hours per day is mandatory. Why is it mandatory? Because your exam wants to right, make you write for 3 hours. And don't underestimate this thing. I'm telling you the biggest thing. And this year also, after the DNB theory exam happened, the messages that I got, one that I got, sir, everything what you taught came in the exam. Really, sir, every paper we felt like we are listening to you while we are writing. So that was something that I was very happy about. The second thing they said, sir, we knew everything, especially in paper 3 and 4. Why? Because by that time you are terribly tired. We knew everything, but we were not able to write. So that tells you the importance of two things. One, it tells you the importance of writing at least 10 to 15 days before the exam. Start writing 10 to 15 days before the exam. Second, it tells you the importance of keeping things crisp, concise, and conceptual, because in the exam, even if you know the topic in great detail, you don't have time to write it. See, in DNB you have 180 minutes for 10 questions, so that is 18 minutes per question, and every question is divided into 2 or 3 parts. Average is 2, so you have about 9 minutes for a 5-mark question. You have about 9 minutes for a 5-mark question. So you have to read the question, which is now on a computer screen. You have to read the question. You have to realize what are the anesthetic concerns, and then you have to start writing, and then you have about say 8 minutes to write it, because 1 minute will go in reading and remembering and looking here and there. तो ऐसा नहीं होगा कि आप 9 का 9 मिनट लिखने वाले हो. तो practically you are going to get 7.5 to 8 minutes to write a question. Imagine how small that is. And you have this thing where you are going to get sequentially more and more and more tired, so your level of concentration and your ability to write faster would be very high in the beginning, and then sequentially it will become slower and slower and slower. So you have to factor in all these stages. Flip pages and create general approaches to any answer, and that is what we have also done. We have created general approaches. Cardiac patient आया तो क्या लिखेंगे, पीडियाट्रिक आया तो क्या लिखेंगे, लैप्रोस्कोपी आया तो क्या लिखेंगे, न्यूरो आया तो क्या, ऑब्स आया तो. So every broad specialty, every broad subspecialty will have a general approach. Every general approach, you only have to make sure that if the patient is PIH तो ये लिख देंगे, anemia तो ये लिख देंगे, GDM तो ये लिख देंगे, RH negative तो ये लिख देंगे, sickle cell तो ये लिख देंगे. समझ गए? So एक general approach to obstetric anesthesia, and then just the tweaks that you have to make for individual approaches. This is the best way to remember things in the exam and also make a very coherent answer. And last 3 days should be only volatile topics, which can come even in paper 1 of DNB. Don't consider कि paper 1 of DNB में recent advances नहीं आता है, उसके किसी भी paper में कुछ भी आता है. So you discuss topics like recent advances, focus and anatomy, because anatomy में diagram बनाना है. diagram आपने जाने के 2-3 दिन पहले नहीं देखा तो आपको याद नहीं रहेगा. Okay, now I know you all must be waiting कि सर पढ़ना कहाँ से है. So resources, I'll enumerate all of them. Standard is of course the textbooks, that is Miller's, Barash, Morgan, Hasdick for regional, Baheti and Dosh for instruments, Stolting for pharmacology, Rashid Khan and Benumov for airway, Kaplan for cardiac, Cottrell for neuro, Smiths for pediatric, and Harrison, Paul Marino, Oxford and Chang for mechanical ventilation and critical care. Let's be frank enough, even if you are able to read say 10 to 15 pages of each of these books, I will consider you a winner in residency. होता नहीं है. Ultimately we all resort to exam based resources, which is of course race, which is a wonderful excuse me, absolutely wonderful resource. You have Tata ARC, which I feel is a complete book for practical and a ऑलमोस्ट कंप्लीट बुक फॉर थ्योरी. सो प्रैक्टिकल तो उसमें कोई मैच ही नहीं है. मतलब टाटा ARC से अच्छी बुक आई हैव नेवर सीन फॉर प्रैक्टिकल्स. एंड फॉर थ्योरी very exam oriented, but sometimes you don't remember because of the way they have written it. They have written it in a very mundane way. It's all black and white, question answer question answer question answer. So even if you have read that book, you don't really remember it. Same with Kaushik Jyotinath, excellent book for DNB, but it is not something that has written things in a very interesting manner. किसी और के अवेलेबल नोट्स हैं अगर, ऑल्दो मैं बहुत पसंद नहीं करता हूँ, बट देयर आर लॉट ऑफ पीपल हु आर okay with other people notes, and you know the names, I don't have to take them. There are a lot of people who have made amazing notes, and I feel that if you are okay with them, you should go ahead. And all the free resources, this is something which I recommend क्योंकि मैंने ये बहुत पढ़ा है. मैंने बहुत आर्टिकल्स पढ़े, मेरे पास फोल्डर थे आर्टिकल्स के, मैंने पता नहीं कहाँ कहाँ से डाउनलोड करके रखे थे। द कॉमन वन सर, आई जे, बी जे, ए टी ओ, टी डब्ल्यू। ए टी ओ टी डब्ल्यू आपको आई होप पता होगा, एनेस्थीसिया ट्यूटोरियल ऑफ द वीक, एंड नाउ दे हैव surpassed 600 sessions, 600 tutorials that they have taken, and it's amazing. IJ, BJ have also great review articles, right? So these are the resources that you can use. But yes, if you want an X factor in the preparation, so here I am. That is why I am discussing this thing with you all. My idea is to not only guide you regarding the broader aspects of your preparation, but also the specific aspects of it. So for that, I have started Anesthesia Resident Masterclass, which is taken by me. And we started in February of 2023 with the idea that we are going to only discuss some few very interesting but untouched topics like anesthesia machines and airways and vaporizers and gas laws and physics and anesthesia. And slowly with your efforts and your motivation, I was able to cover a lot of things, and we have recently covered 100 plus topics, and now we have reached a stage where we have so many of our sessions that you can practically pass the exam only by watching what I am saying. And just like how I'm trying to simplify this approach for you, I have simplified anesthesia for you. I've given you a very crisp, conceptual, and complete discussion of the topics with concepts. I write notes with you just like I'm writing right now. And when you are watching my videos, even if you keep a pen and a notebook, the moment I am writing, you write. So while you are reading the topic only, that is the time. There is no PPT based teaching. So there are no boring next slide, next slide, next slide, next slide, because वो तो क्या है, वो तो हर किताब में दिया हुआ है. You don't need me for PPT based teaching, right? Most easy to remember and reproduce. And this is my experience of over 600 residents who have been a part of my course, who are still a part of my WhatsApp group. And I've been extremely grateful for them, because every student has not only helped me become a better teacher, but they have imbibed what I have taught, and they have done all excellent. And we keep adding 2 sessions per week. There is a live doubt solving and a dedicated group of residents for help support for everything. Finally, what are the key areas to focus? High yield topics from past paper. Ultimately, your past is your future. तो अगर आपने पहले के सारे क्वेश्चन कर लिए तो एनीवे सारे क्वेश्चंस फ्यूचर के भी हो जाएंगे. फ्लो चार्ट्स एंड टेबल्स फॉर क्विक रिविजन्स व्हिच आर यूजुअली गिवन इन मिलर्स एंड बराश, एंड थॉरो अंडरस्टैंडिंग ऑफ गाइडलाइंस एंड प्रोटोकॉल्स. रिविजन फेज, week 1 and 2 intensive revision of core topics, 3 and 4 simulated test and refining answers, and then last में 2 week is group discussion and rapid review. You have to have an exam based approach where you read the questions carefully and underline keywords, use diagrams, flowcharts to enhance answers, and allocate time wisely for each section. I told you that there are 10 questions, there is 180 minutes, so ultimately it's 18 minutes per question. And because every question has same weightage, so you can't say कि मेरे को ज़्यादा जो आता है उसमें मैं ज़्यादा लिख दूंगा तो ज़्यादा मार्क्स मिल जाएंगे, ऐसा नहीं होता. DNB gives very average marking unless and until you are very brilliant with a very beautiful handwriting and you have written actually an exceptionally good answer, and the exam, the person who is checking the answers is in a good mood, that is when they give really good marks. What are the tips for success? Stay consistent and disciplined. Start today. Don't think a nice time will come where you are going to start studying. Start today. Join discussion groups for peer learning. And I believe this is very important. One discussion group is what we do in our WhatsApp group. But otherwise you can always have your friends. You can find time for evening tea. जब आप लोग हॉस्टल में जाएंगे, आप चाय पी रहे होंगे, तब एक टॉपिक डिस्कस कर लें. टेक ब्रेक्स and maintain focus and practice writing answers a lot. I cannot emphasize more on this. More than what you are going to know for the exam, the biggest challenge for you would be what you are able to write in the exam. So if you do not have a practice of writing, you won't be able to ultimately reproduce everything that you're supposed to know. All the very best. This is something that I've been wanting to tell you for a very long time, but of course I was not getting a lot of time to do it. But this is a very comprehensive way of preparing for the exam. But of course I'm always available if you need any specific guidance or advice, or if you are stuck somewhere and you need some motivation, you can always contact me on WhatsApp on this said number, and I'll be happy to guide you through. All the very best, my best wishes, and remember, I'm always there for you, irrespective of whether you are a part of my course or not. My idea is to be there to guide you through your entire residency, irrespective of where you are, what you are doing. So you can always contact me on WhatsApp and we can have a chat. Thank you so much, and God bless you.